health segment on the show. My name is Ajwa Hetty. One searches for a physiotherapist when a doctor recommends one. A lot of Ghanaians do not know about physiotherapy and its importance. But do you know that physiotherapy helps restore the function and movements of a person affected by an illness, disease, injury, or a disability? Today on this show, we will be talking about physiotherapy and its importance. And I have here with me PT Judge Asiedu Boateng, who is going to tell us about physiotherapy into details and how it is important.
Do you have a vision to become one of the finest multimedia personalities in the country? Then Abro Media, now Doxa Open University, is your ultimate choice. Get your multimedia and technological training from Doxa Open University, the first and fully fledged multimedia, technology and communication university in Ghana today. Doxa Open University offers diploma, advanced diploma and degree programs in journalism and communication studies, sound engineering, TV production and video editing, graphic designing, animation, event management, web designing, software engineering, telecom engineering, multimedia entrepreneurship, modern leadership and governance, textile and fashion designing, screen acting and disc jockeying. We are fully accredited by COTVET and ICM UK. The school is also recognized by the Ghana Education Service. With campuses sited in Accra, Takoradi and Kumasi, you are assured nothing but the best multimedia and technological training. Contact us on 0244-263011 or you can as well WhatsApp us on 0577-263011. Visit our website on www.doxaopenuniversity.com. Doxa Open University, innovating and perfecting tomorrow's multimedia technology today.
PT Boateng, welcome.
Thank you.
Okay, so all that being said, physiotherapy, we normally know that people with stroke, maybe they have a little brain problem coming in and out, but who really is a physiotherapist?
Physiotherapy is a very vast and wide subject or health type of work that people don't know about. We work holistically with when it comes to heart surgery, we are there, burns, we are there. When it comes to the pulmons, we are there. Even those people are even on dialysis, they also need physiotherapy. Even just having a normal malaria sicknesses, we are there. We are all over. We have to restore, as you said, the movements, injuries, disability, the stroke patient and the rest. We have to solve all these kind of problems as well.
Alright, PC, we know that, people go into the hospital with so many types of illnesses just to, feel better. But then how do you treat your patients differently from the way a doctor treats his or her patients?
Normally, physiotherapy, as the word goes, physical therapy, and it has been put together to mention physiotherapy. It's a physical therapy and rehabilitation, just like having an old building. What do you do to an old building if you want to restore or rehabilitate it? If the wall is broken, you go for cement, fix it up. If the paint is rough, you look for a nice paint, you paint it again. If the roof of the building is also off, you do the same thing to it, fix it with a new roof, and everything becomes new, but it's the same old building.
Yeah.
That's what we call the rehabilitation. And then the physical therapy, if a patient is having a broken bone and the orthopedic have already worked on it to maybe fix it, you have to restore the patient back to his or her normal life. Like if the person used to work or walk or do everything, is a physiotherapist who will come in to restore the life back as if nothing has ever happened to the person. But sometimes, it can be maybe 90% back to the normal life. It's just like having a car which is broken down. You buy a new engine. The new engine that you put in can never ever be the same like the engine that you brought.
Yes. So, PT, do you have a particular group of people that you treat, like let's say pregnant women babies, children, elderly, or there's just one group of people?
All kinds of people. Everybody. Even you, me, all of us, we all need physiotherapy. We don't have specific people that you will say this person needs physio or this. Everybody needs it. Because when it comes to the gym, the exercises and the rest, you don't have to. That's the word we use. That's when we use prophylaxis. It's the maintenance basis. You see, when you are, as I am, in every year, the whites, they go for checkups, especially about 2 times in a year. Every 6 months, they go for checkup. But we, the Africans, we wait till we are sick before we start finding solution to our problems. But the white will not wait for that. That's what they call the prophylaxis. Okay. The maintenance basis is what we, the Africans, we are lacking.
So, doctor, you spoke about restoring the person back to the way he or she used to be. So, does a physiotherapist only assess the physical condition of a patient in order to diagnose a problem or implement a treatment plan?
It's one of them.
Okay.
But there are other things that we do. As we also do the psychological level, because sometimes a patient may be sick. Let's take, for example, a stroke patient is sick. The person used to do everything normal as how he is. And automatically when this sickness comes, cannot move part of the body. And then he sees you doing or she sees you doing this or that. And you are not doing it perfectly as how he or she would do it. Psychologically, it affects the person. And then that's when the challenges start coming. I used to do this, I used to do that, but now I can't do it. And the person who is doing it is also not doing it as how I like. So you have to work on the psyche of the person as well.
Okay. So talking about that, what about emotional health issues like depression, anxiety, those who have suicidal thoughts and behavior? Do you also treat such people?
Yeah. You know, just having depression and anxiety, when it can also have, you know, you can get stroke from it.
Yes.
Yes, because when you have very anxiety or depression as well, it can let the pressure go up or come down. That if it comes down below the level that is supposed to, pushes the blood into the brain, it can also affect you as well. And you know, depression, anxiety, when it can also be the same thing. So we work on all of them as well.
Doctor, we've heard about the neurological physiotherapy that has to do with the physiotherapist focusing on the movement disorder of the person that has resulted in, let's say, a damage with the central nervous system that has to do with the brain and then the spinal cord. But apart from this neurological physiotherapy, do we have other types of physiotherapy?
A lot.
Can you give us
you just mentioned neuro. Yeah. We have neuromuscular skeletal, which have to work with the nerves, the muscles, and the bones themselves. Okay. So we work on all of them. Just like somebody coming to say, me koya meya, me sisi ya meya, me kotoje ya meya. They are all part of the bone problems. At the same time, so the person can have what we call the stroke, which is part of the body with the neuro. Okay. You know, when the stroke happens, is because there's no blood flow into the central nervous system, and then the brain will automatically shut down because the blood not flowing, which is not containing oxygen, so the blood will not flow into the central nervous system, and then the brain will automatically shut down. Yeah. And we have what we call the emotional therapy as well, that we do help them with all that. We have the respiratory aspect of it with the pulmon. If somebody is having what we call the mucus stuck in the throat and cannot even breathe well.
Yes.
Yeah, we do what we call the drainage as well to suck everything with the cardio aspect. After the surgery, we work on them as well. So there are so many things that the physio does.
That's very interesting. But talking about neurological, we know we have this neurological disorder like epilepsy. Do you treat such patients, and after treatment for a long time, are they able to get back to normal? Like they are not able to have these seizures anymore?
You know, that's one thing that a lot of people don't understand. There's a little bit of differences between the seizure and then epilepsy.
Okay.
Yes, but the seizure happens once. It doesn't repeat itself like how epilepsy does.
Okay.
See, that's the difference between the two. So when the seizures happens continuously, it becomes epilepsy. That's when you get epilepsy. But it's a medical condition. Physio can help to treat. Maybe because of the epilepsy, you have this kind of with kids normally we call it CP, cerebral palsy, that it can affect one side, or in adults we say stroke, but in kids is epilepsy, is CP. You see, so we can also help, but it's more of medical condition that needs to be advised, give medications and the rest.
So it's not something that can go just once?
No, it cannot go just once.
Okay. But what about if you've had a lifetime treatment? You know, you've been coming for treatment for quite a long time.
You see, most of this epilepsy and the seizures comes with people with this kind of sickle cells. That's the SS and sometimes the CS. So it's a long time treatment, especially with the stroke patients. You know, just like what I'm doing for her. You know, with the stroke patients, when it happens, the patient cannot move the hand or the facial expressions or the leg, it will be affected. Normally, it's asymmetric. When it happens on the left side of the brain, physically, it affects the right side of the body. Or in the right side of the brain, physically, you see it affecting the left side. So you can see what I'm doing. This is what we call the electrical stimulation, to help repeat movements and also to restore and to strengthen the muscles. So most of them cannot move the hands or the legs, but as she's lying down, you can see the machine automatically helping her to move, to repeat movement, and automatically the physical part of it is there where she is moving it, and psychologically she sees the hand moving, so it will also draw psych her up that please, you have to move the hand. See, and it's the same thing to the leg as well. And also the electrical stimulation also helps with pain. If you're having pain, if you are having any inflammatory aspects, with this cervical problems, the waist spondylosis, knee pains, arthritis and the rest, it helps to alleviate the pain. If you're having a nerve issue, the nerve lesion, inflammation, it all helps with all of them.
So if I'm getting you right, there could be a patient who has half of the body responding to treatment and everything, and the other half not responding. So with these machines and other things, it would help to restore the other half of the person.
Yes, it really helps. It really helps.
That's very, 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 very interesting. Okay, so Doc, I've been getting you physiotherapy, but then how is a physiotherapist different from a physician?
The main point is physiotherapy. As at the moment, especially in Ghana, we do not prescribe drugs.
Okay.
But a physician can prescribe drugs. And we use hands-on. We use hands-on. We touch patient. We do the massage. We do the electrical stimulation. We help them with the gym aspect, exercises and the rest. But physicians are mostly consultants. They are in the consultation room. You come, you write, and even giving injection and the rest is the nurses who normally do that. But for us, we work physically.
Working on a patient physically, what are some of the conventional equipments we could find around? We
have a lot. A lot. We have the shortwave diathermy. That is for those who are having deep pain, deep root pain, to help to give a lot of heat. And then we have the hydropacks, which helps with the superficial pain. We have the cold packs when there's inflammation, to reduce the inflammation. We have the electrotherapy machines. We have the Saragem. There are a lot. The infrared that we use, the ultrasound. But the ultrasound, we have two types. We have the diagnostic ultrasound, but we use the therapeutic ultrasound. Wow. to help solve problems, not to diagnose. That's the difference between the two ultrasounds that we use. So, and then when you go to the gym, we have a lot of equipment. The treadmill, the bicycle, the quadricep, the shoulder press, the butterfly, a lot, pulley, whatever you can talk. So we work with a lot of equipment.
With all that being said, how are you able to manage your time effectively? Because, a lot of our patients have sections coming in, going out. How are you able to manage your time effectively?
It's very difficult, but, it's part of your job. That's what you have done, and you wanted to help people. So the dedication have to be there to manage your time from the house. But when coming to work, it should be a different thing altogether. Set up your mind that you are at work, you're coming to see your patients. Your patient will also be coming with their problems. Will you also be telling them your problems? No. Throw that one away, backside of it, and then concentrate on your patient, work with them, and then after that, you can go back to your normal life. Yeah. So if you are ready for the job, automatically you can do it. Okay. You can do it.
Peter George Asiedu-Boateng, thank you very much for your time. You've really educated us. Thank you. We will come back again to learn more insights about physiotherapy.
Very well.
Okay, viewers, you've heard it all. Dr. Boateng says, do not sit at home and wait till you're sick before you see a doctor. Endeavor to come to the physiotherapy center just to have your body checked. Who knows? You might have a little problem there. Thank you for staying tuned with us. This has been the health segment. My name is Adra Hetty.
Do you have a vision to become one of the finest multimedia personalities in the country? Then Abro Media, now Doxa Open University, is your ultimate choice. Get your multimedia and technological training from Doxa Open University, the first and fully fledged multimedia, technology and communication university in Ghana today. Doxa Open University offers diploma, advanced diploma and degree programs in journalism and communication studies, sound engineering, TV production and video editing, graphic designing, animation, event management, web designing, software engineering, telecom engineering, multimedia entrepreneurship, modern leadership and governance, textile and fashion designing, screen acting and disc jockeying. We are fully accredited by COTVET and ICM UK. The school is also recognized by the Ghana Education Service. With campuses sited in Accra, Takoradi and Kumasi, you are assured nothing but the best multimedia and technological training. Contact us on 0244-263011 or you can as well WhatsApp us on 0577-263011. Visit our website on www.doxaopenuniversity.com. Doxa Open University, innovating and perfecting tomorrow's multimedia technology today.